Good afternoon, Colorado. We have some important updates on coronavirus, the state response, what's working, what's not working. We'll have an update from Dr. Rachel Herlihy, our state epidemiologist, as well. Top line is we're at 62,099 positive cases, 400 new positive cases today. In terms of new cases, 6 of the last 14 days have been down. 8 of the last 14 have been down on hospitalizations. Dr. Herlihy will give a really good epidemiological update on kind of where we're at with regard to that. Well within our hospital capacity, and we continue to learn every day in Colorado, just as citizens across the world are, how to live with this virus in a sustainable way, one that we can keep up until there's a vaccine or cure. There have been some modest therapeutic progress in the last few months. Remdesivir, obviously the blood from those who are already infected with the antibodies. So these are modest, they're not game changers. There's strong evidence that they're helpful, both in reducing hospitalization time and hopefully in reducing the fatality rate. Before we turn more fully to the COVID update, I want to give an update on the fires that continue to rage across Colorado. For several of the largest fires, our focus has turned to recovery, which often includes looking at effects on avalanche mudslides as we move into wet season, watershed protection. The Cameron Peak Fire continues to rage, 102,596 acres, only 4% contained. 3 primary structures destroyed, 22 homes destroyed. We believe they're all second homes or cabins. Still a terrible loss, obviously, for the people involved, but not the primary residence. Middle Fork Fire, 4,700 acres. That's not contained yet in Routt County, 0% contained. Pine Gulch is up the largest fire in state history, 139,007 acres, 95% contained. Grizzly Creek, the one that required the closure of Highway 70 right alongside Highway 70, 91% contained now, 32,431 acres. And the Williams Fork Fire, 10% contained, 12,157 acres. For any state workers that are evacuated as a result of the fires, you do get paid administrative leave to ensure that you can move your family safely. I hope our private employers are doing the same for those who had to evacuate. We are in some ways, just by luck, more fortunate than our friends in Oregon and also in California with regard to the location of these fires. A lot less homes have been affected than we hear about in states like Oregon, where upwards of 500,000 people were dislocated. At the height of these fires, including the advisories, just people that weren't ordered to evacuate but were given a warning that they could evacuate. It was only a few thousand people, and the largest fire in state history really was successfully kept away from where there was development in homes by and large. So that's luck. Where but for the grace of God go I, the fires could have been in a very different situation as they were in other states. So we're grateful for that. But we also know that with a drier and warmer climate, we need to be prepared for more of these kinds of fires in future fire seasons. And of course, this fire season isn't over yet. Getting back to coronavirus, as you know, one of our top priorities is transparency, making everything that we know available to you so you can make your own informed decisions. We want to make sure that people know exactly where the virus is at any given time. A few weeks ago, we saw some encouraging signs, our positivity rate and hospitalization rate remaining low. Now, some of those early warning signs are starting to be seen. We're a little bit worried about the recent uptick in numbers, driven in large part by some of our colleges. Dr. Herlihy will talk about that in more detail. But the worry is that the college transmissions lead to community transitions. We know that our students don't live in complete isolation from communities. Many of them have part-time jobs in retail or restaurant, interact with other members of the community. And Dr. Herlihy will talk about some of the progress it's made and some of the challenges we face in terms of where the reproductive number is, where our social distancing number is, the threats and the opportunities that lie ahead in the next few weeks. And with that, I'll turn it over to our state epidemiologist, Dr. Herlihy.
Thank you, Governor. Good afternoon. So I'd like to provide you with an update on our state trends, and we have some data slides that we will be showing you. So this first figure that I'm sharing with you today shows you our overall case trends. And this is a figure that I've shared with you previously where we color code week over week whether we're seeing an overall increase or decrease in the number of cases that are occurring in the state. And so what you'll see in this figure is that in the last 2 weeks, we have seen a slight increase in the number of cases that we're seeing here in the state. And we believe this is part of an overall trend where we're seeing increases also in our other stats that we're keeping track of. And we'll go a little bit into this in more detail as we talk about some of the modeling data. But if we go to the next slide, you'll see that similarly, we have seen weeks in the last couple of weeks where we have seen an increase in our percent positivity trend. Overall, we seem to be in a bit of a plateau when it comes to percent positivity. Next slide. And similarly, we continue to be in this plateau when it comes to hospital admissions, keeping in mind that hospital admissions can sometimes lag behind our cases when it comes to changes in trends. And I'll talk a little bit about the age-specific data as well, but this could be another reason why we're not quite seeing an increase in our hospitalizations at this point, is that we're seeing really a greater percentage of our cases occurring in some younger populations. And as the Governor mentioned, our concern when we see an increase in cases among younger populations is, of course, that those cases will spill over into our more vulnerable populations, some of our older age groups, where we could potentially see much higher rates of hospitalization. Next slide. So these are those age-specific trends that I was talking about. And what's shown in this figure is the age-specific rate of disease that's occurring. If you look at the orange line and the red line, you'll see that those are trends among 10 to 19-year-olds and 20 to 29-year-olds. And if you look at the trend for the 10 to 19-year-olds, you'll see that we've had 2 weeks of increasing trends. If you look at the 20 to 29-year-olds, you'll see that we've had 1 week of an increasing trend among those age groups. But because of the way that those age group lines are drawn, it's really difficult for us to specifically understand what might be happening in college settings by the way these lines are drawn. And so I have the next figure for you to go into that in a little more detail. So what this figure is showing you is the very substantial increase that we are seeing among college-age individuals. And this is a trend that is also being seen nationwide. So you'll see that college-age individuals, so those 18 to 22, we've seen a substantial increase, with the greatest increase really occurring among our younger college students, so college freshmen and sophomores, so those 18 to 19-year-olds. At the same time, we're actually seeing relatively stable trends in our 10 to 17-year-olds, so our school-age kids. So at this point, that's reassuring in the state that we are seeing stable numbers among those school-age children. But certainly the trend is indicating to us very substantial increases among our college-age students in the state. Next slide. So I also want to talk just a little bit about some of our outbreak data as well. So while we are seeing increases in those 18 to 22-year-olds, we're also at the same time seeing a substantial increase in the number of outbreaks that are occurring in those age groups. We have seen 6 outbreaks reported to the state in the last week that are based in colleges or universities in the state. And we actually, based on the number of outbreaks that are under investigation right now, expect that number to double probably by the end of this week. So back one slide, please. Transitioning to some of our modeling data, this figure shows you number of hospitalizations that have occurred in the state. So each of those black vertical lines represents hospitalizations that have occurred in the state. And the colorful lines represent different fits of the model based on different levels of social distancing or that effective reproductive number. And so what you'll see if you look at the most recent fit of the model to the data, so the model fit on the 7th of September, you'll see that our effective reproductive number, that R value, which corresponds to, on average, how many Coloradans are infected by a single infection, you'll see that we've started to trend upward. So we've gone from a place where we've seen declining hospitalizations in the state to a place where we're seeing stable, flat hospitalizations with a slight upward trend. And for us, this indicates the potential that we could be entering into a growth phase of cases once again in the state. Next slide. And that effective reproductive number is shown in more detail here. So you can see that from late July through mid-August, we were in a pretty good place with our effective reproductive number. It was less than 1, meaning that we believe the pandemic or epidemic here in the state was stable. Overall, we saw case counts decreasing, but unfortunately, just with the most recent fit of the model, we are seeing this effective reproductive number now above 1, indicating that we could see potential growth in the next couple of weeks. Next slide. And so the estimates that we are seeing right now for the level of social distancing in the state are probably right around 65%. And we've talked over the last several months about the level of social distancing we need to achieve in the state. And we're really right at that level of social distancing where we could potentially see growth again. And so this figure is showing you what could happen in the state if in the next couple of weeks we potentially saw our social distancing levels continue to decrease. So right now we're estimating about 65%. Several weeks ago we were really much more in the 75%, 80% range, so we know that social distancing has been drifting down. If we were to continue to drift down, we could potentially see some additional stress on our healthcare system. So this figure is showing you where we are right now, the dark blue line. If you look at the figure on the right, the purple, yellow, and red lines indicate potential trends that could occur in the state if we were to see social distancing continue to decrease as it has the last couple of weeks. That's everything I have for you today. Thank you.
Thank you. We've lost 1,905 people in Colorado to COVID, 1,996 with COVID, but 1,905 directly to COVID. And again, each one is a tragedy. And to the families of those who were lost, you have the condolences of an entire state, an entire nation, an entire world. Thank you, Dr. Herlihy. These are concerning trends, not terribly surprising given Labor Day weekend, given colleges resuming. I think it just really means for each and every one of us how we need to dedicate ourselves to the best known and effective prevention methods: wearing masks when we're in public, avoiding large gatherings, getting together only in small groups, washing hands regularly. That's our toolbox that we have. We know what works. Coloradans have been doing well in those areas. And I want to encourage Coloradans to continue. We all are tired of the virus, but the virus is not tired of us. So it's still here, and the minute we give it the lifestyle that allows it to expand exponentially, it would. So we just have to continue to be smart, be cautious, and really go about our lives in a careful way. Going back to the issue of transparency, today we're also unveiling something that the health department has been working on for a while that really increases transparency and clarity and predictability. It's a dial that gives real-time data on a county-by-county basis. It's a visual representation. We're all accustomed to those of us who live near, especially near the mountains. I grew up just north of Boulder. So we have these fire dials that show whether the risk is low or medium or hot, and when it's high, you can't do certain things, and they're very visual, sort of modeled after that. I think Coloradans are no stranger to the fire danger bars. This is a visual representation of where COVID is in each community. So it's county by county. It's launched today. This will help inform your county leaders, your commissioners, your health department as a tool to how to control the virus within the county borders, maintain public health, keep the economy growing. Those are the important aspects that are critical, and there will be one for every county. You can view your counties at covid19.colorado.gov. The dial framework has to protect our neighbors, the safer at home. It has all the different phases. It's based on 3 key metrics: number of new cases, the percent positivity of COVID tests, and hospitalization. So it's just entirely data-driven based on those 3 criteria. To move to as local governments can successfully move to protect our neighbors, then we're trying to do away with the state restrictions and just say it's entirely up to you. So that's where Mesa, Rio Blanco, and Gilpin were last week. And today they're joined by 2 more counties, Gunnison County and Moffett County. I want to congratulate Gunnison and Moffett on reaching the protect your neighbors phase. That's where, again, it's up to you, the mask wearing, it's up to you whether you want bars to close, normal time or earlier. So that's a real big step. I can't wait till all 64 counties have that complete authority. It's never a good model for that to be centralized at the state level. We've really embraced local decision making and believe that local communities are the best ones to balance their economic needs with the measures they need to undertake to save lives. And we want to be a partner in that for the state. And this DIAL program is a new part of that partnership. If a county struggles, there's a chance to regain their numbers, and then they can work with the Colorado Department of Public Health and Environment on how they can move forward in a way that takes into account the local factors, the data, other mitigations. They might think of one at the city or county level that we don't even think of or know about at the state level, and we're happy to embrace that. We're happy to encourage that. Objective and metrics and data are there for a reason. They put a process in place, but local factors are really paramount in actions, and we want to make, and we know we have really great, creative, data-driven local partners in all 64 counties in the state, and that's really what's been exciting about the approach from the start. So you remember we originally called all that the variance process. Many counties had variances. I think Grand Junction, Colorado is one of the first, if not the first area in the entire country to have dining in restaurants, really from the start of this crisis. This formalizes that in a way where rather than go policy by policy, restaurants or bars or masks, we say, okay, you've achieved protect our neighbors. The other piece of protect our neighbors is as long as your data needs to be strong, then you also need to have the strong public health capacity to really provide early intelligence into any outbreak. So they look at testing and they look at a number of things like that. The DIAL framework generally replaces the variance process. Counties can still do variances. A good use of variances is when there's a really big venue that has a specific protocol around it. The Denver Zoo, which opened very early, ahead of almost every zoo nationally as an example, that's a unique property. They worked on how they were going to open. They did it safely. Botanic Garden, the Broncos. These are folks that are unique enough by their venue that they do that. The general guidance under Protect Our Neighbors allows everybody else to operate in a reasonable way, gatherings up to 500 without any additional paperwork needed. So it's a big part of our return to normalcy, which Colorado has been and will be a continued leader on as we learn to live with the virus. The flip side of that is, of course, the communities take on the responsibility to act, right? So nobody cares more about lives in Rio Blanco County than the commissioners and the residents of Rio Blanco County. So we want to empower them to be able to do what they need to grow their economy and save lives. The key to our success against the virus is really empowering and supporting that local response. It's individual choices that people make, smart choices, wearing masks, avoiding large gatherings, staying 6 feet from others whenever possible, washing their hands. That's the reason that Colorado is doing as well as we're doing. Colorado's not monolithic. Different counties and communities, and even within counties, different cities have different experiences with the virus. And we want to do everything we can to arm those local decision makers with the tools they need in each area. Transparent information, objective benchmarks, and really empowering local officials to move forward faster or slower than the state as a whole in this. So we're also, as I said, we're launching this new dashboard that tracks these metrics, so you'll have them. It'll track what goes into the DIAL. It's very important, maximizing transparency. It's not some mystery thing. It's driven by data that will be available to you. This virus is not going to disappear tomorrow. In fact, we're worried about the increase in positivity rates we've seen, and one way to drive down positivity rates is to have more testing. One of the reasons we look at positivity rates is it tells us whether we have enough testing. We know we're missing people until they show up in the hospital, which is often 2 weeks later, that have the virus if we don't have the right tracking in place and testing in place. So I do encourage anybody who is developing symptoms, flu-like symptoms, or was exposed to somebody who was sick, to get a free, quick, easy test. You can do it at the Pueblo County Fairgrounds, at Citadel Mall in Colorado Springs, at Waterworld in Federal Heights. at the Aurora Sports Center, at Pepsi Center, and Mesa County Fairgrounds in Grand Junction, many other local community sites, covid19.colorado.gov, you can look it up. You can, of course, also inquire with your doctor or community health clinic about their testing. Many of them have it too. But we offer these free, quick, and easy drive-through sites because the more that we can have visibility in testing, the quicker we can make sure that everything gets back to normal because the better visibility we have. I have a few questions from Facebook that I wanted to read first. Carol says, there's no reason to get tested. Even if you are not ill and do not have COVID, it will be counted as a positive. Then you and everyone you hang out with will be tracked. Just say no. So just want to refute that. That's not true. We have a 2 or 3% positivity rate of the testing at the testing centers. Most people test negative. The tests are highly accurate. Dr. Herlihy, I think over 99% accurate. Very, very accurate testing. And of course, if you have a negative test, there's no tracking or tracing or anything else. You just have that peace of mind that you, at that point in time, do not have the virus. Doesn't mean you won't have it a month later or 2 months later, but at that point in time, you don't. Amy says, you can't be serious. There's no reason for people to go to a test station, period. If someone is sick, go to the doctor. You're encouraging healthy people to get tested. No need for them to get tested. Go see your doctor if you're not feeling well. Let a professional diagnose you and determine if you need to be tested. You can do that, but all a doctor would say is get tested. There's no objective criteria a doctor can use to definitively identify coronavirus. They might suspect it if you have a cough, fever, but it may not be coronavirus. So you can go through your doctor, of course. And by the way, it might be important, especially if it's not coronavirus. If it's a bacterial infection, for instance, like strep, you might need antibiotics. But you can also do that yourself. So if everybody was willing to see their doctor and did that, there wouldn't be as great a need for these free, quick, and easy testing sites. But a lot of people don't have a doctor-patient relationship, especially younger people in their 20s and 30s. Many of them don't really have that relationship where they can go in and see a doctor, or they worry it costs money, or they worry it takes time, or they're worried about booking availability with their busy job. Today's customers, the people of today, want free, quick, and easy. They want to be able to go whenever they want, take 15 minutes, get their result, not have to deal with doctors, with paperwork, with potential fees. So if you have that doctor relationship, if you see one, if you call them, if they want you to come in and get tested there, you absolutely can. Many people get tested that way. But it is also important, Amy, that many Coloradans are deterred from doing that unless they get very, very ill. And especially younger Coloradans, and we want them to be able to take advantage of that free, quick, and easy testing. And the proof is in the pudding that it's been so popular. So many people, every day are taking advantage of that. So clearly there is a market and a need there for it. Just 2 quick more ones. Thank you, Polis. We love you. Thank you for giving us options and keeping our numbers low by mandating masks. Thank you for being, and this is Judy now, thank you for being a steward of our community health by testing and extending the mask order. And finally, Adam said, get tested, slaves, so I can keep locking down the state. I just want to, again, so this is the opposite of, the more testing there is, the more restrictions go away. So the more visibility we have, the safer it is, the more percentage of cases have the contact tracing, the quicker things return to normal. So, I mean, the best thing that anybody can do if you want things to return to normal is if you are ill, get tested. If you are exposed, get tested. If people are not doing that, the virus lurks underground. Eventually people show up in the hospital. Some of them die, but that is weeks after. And then we missed all of those early weeks of the ability to track and trace the contacts. By that point, one case could have gone to 86 or 150. And that's really the reason for why it makes sense for everybody, if you're ill, to get tested, if you've been exposed, to get tested. We are going to do as well as you want us to do in this Colorado, right? So if too many Coloradans have that attitude that they don't want to get tested or don't want to wear masks, we will do more poorly and more Coloradans will die. If Coloradans embrace finding out if they have it, if they're sick, and wearing masks and following quarantines if they're contagious, then we will return to normal a lot sooner rather than later. So that's the update today. It's in your hands, Colorado. I know you can do it. You've been doing it for months. I know we're tired of it. It's not tired of us. Let's keep going. Let's be careful and let's be thoughtful. Not a time for fear, not a time for anxiety, a time for caution, and together we'll get through this. Questions? Phone. Louder, please.
Hello. Can you hear me?
Yes, please, go ahead.
Sorry, yeah, this is Mary in Government Colorado Public, and I have two questions. I'm fascinated by this dial dashboard, and what stands out to me when I look at it is roughly about 20 counties that are at the safer level 1, that the blue counties here. And included in that group is Kiowa County, which has never had a single case of COVID in 6 months. So I'm kind of curious about what the data is with what a county that's never had any cases in counties that have had, in some cases, dozens or hundreds of cases. And then my second question is if you want to respond on the news that recall has been launched against you. This one targeted the executive orders, and particularly in light of the decision by the federal court yesterday in Pennsylvania that went after some of the executive orders issued by that state's governor. Thank you.
Ms. Kiowa?
Yeah, so I think one of the important things to know about the dial is that counties are entering into the dial for a 2-week period of time, and during this period of time, we will be working with those counties to assess all of those metrics, and that will be evaluated over time in the next 2 weeks, and so there could be some movement of counties after that 2-week period of time.
Yeah. And a county that has no or very low case count would be able to get to protect your neighbors if they want to. That's why we did, it's 5 counties now. Kiowa would simply have to show that they have the public health capacity to stop an outbreak early, but they absolutely qualify from the objective criteria. They're welcome to do that. Now, there's probably not a lot of gatherings of 500 people in Kiowa County, but if they want to have those kinds of gatherings, they're more than encouraged to and have that maximum local flexibility. I just don't think it's been a big an issue there in terms of the desire to have those very large gatherings given the population of the county, but they absolutely qualify for that. And the formula behind how all of those are derived is included as well on the website. Again, we're not going to let any election. There's an election coming up, petitions, recalls. We're never going to let any of that distract us from growing Colorado's economy, from moving forward fast with reopening and removing restrictions. We've waived restrictions just in the last few weeks. We suspended the state rules on learning pods to facilitate and empower parents to do that. Getting rid of red tape there. We've obviously been able to sign some of them into law. We permanently removed the prohibition on takeout liquor being sold by restaurants, and that was started as an emergency order. It became law. We are going to seek getting rid of the 2 a.m. closing time requirement, and hopefully the legislature will agree to make that 4 a.m. at local discretion and move up. So I think coming out of this crisis, there'll be more freedom, less red tape, less restrictions. Some of that we can do on an emergency basis, but some of it needs to be done with the legislature. Of course, I'm going to focus on doing my job every day, which is keeping Colorado healthy, safe, and growing economically and reopening faster than many other states. And so far, we've been successful in that regard.
Governor and Dr. Herlihy, can you talk a little bit about where exactly these college-age cases are linked to? It seems like the University of Colorado Boulder has the majority of them. And I wonder if you can also discuss about what state resources are going to CU Boulder to help them kind of stem this, and also if there are discussions about a potential off-ramp if this starts to get out of control.
So we are certainly working closely with our local public health partners as well as the universities to make sure that they have the resources they need around case investigation, contact tracing, outbreak investigation, and testing. The places where we have really seen the biggest jump in cases among those college-aged kids is really, as you mentioned, in Boulder. We've also seen an increase in that age group of cases in the Denver metro area more broadly. So it's really going to be the places where we have large universities. It's not unexpected that we're seeing these case increases and these outbreaks occurring. We're certainly seeing the same thing across the country right now, and working closely with those communities to figure out how we can really work to limit disease transmission that's occurring in those settings.
Do you want to, Dr. Herlihy, do you want to talk how they also work with their local, their county health departments as kind of the front line of that?
Yeah, absolutely. So our local public health partners are really the organizations that are directly working with the universities on their case investigation, contact tracing, outbreak response activities, as well as working on local policy strategies that could potentially be used to try and decrease the level of disease transmission that's occurring.
Telephone?
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión, Colorado. Gobernador, aún siguen en aumento los casos de coronavirus en el estado, pero ¿qué medidas está tomando para controlarlo? ¿Y qué piensa hacer cuando llegue el invierno y las personas deban estar en lugares cerrados?
Las cosas que cada persona necesita hacer para proteger su propia son fáciles. Es importante llevar tapabocas cuando están cerca de otra gente, pero también es importante tener distancia más que 6 pies, un metro entre usted y otras personas cuando puede. Es más importante en el invierno porque hay más personas entre de edificios y es más importante que siempre tener distancia a más que un metro cuando está posible.
Hi, Governor. This is Vinny Del Giudice at Bloomberg News in Denver. On COVID, are police databases, campus police databases, being updated to show if a person is tested positive for COVID-19 when they run ID checks? There was an example of this in a widely viewed police body cam video from Ohio, an Ohio college last week. Thank you very much.
You want police to be notified when what, again, was the question?
If someone tests positive for COVID-19, campus police. There was an example of this at Miami University in Ohio last week, a widely distributed.
Our police are not notified of positive cases. There is a role of policing in preventing large gatherings. So there have been large illegal parties. Ideally, the law enforcement would simply have a conversation with the owners of the establishment, be it a house or a park, whatever it is, encourage them to dissipate. There are fines that can be used, and that's been used in certain cases, all under civil code, under city civil code, often noise ordinances. Often these are laws that are on the books anyway, and they might be more rigorously enforced during a health crisis. So it's more about the super spreader events than the person who has it. Really, what a lot of the science has shown over the last few months, there's no such thing as a super spreader person. There is such thing as a person at a super spreader event, that it goes from 1 person to 50 people or 80 people. So yes, there are differences in the amount of virus that are shed, but no matter how much you shed, if you are properly quarantined, no one else will catch it from you. And if you go to a large event, many people will catch it from you. So the focus has been, from a law enforcement perspective, on reducing super spreader events.
Governor, I just want to follow up. Is there any discussion with CU Boulder about potentially canceling in-person classes? And I wonder if there's a specific trigger for you where, cases are migrating into the Boulder community outside of the campus that would prompt you to make that kind of suggestion or call for them to do that?
Yeah, I mean, that's really up to them. I think nobody wants to provide a safe college learning experience more than CU itself. Nobody wants to protect their staff and workers more than CU itself. I think that there already have been several dormitories that have been that are on quarantine. And that's really the correct way to approach it. It's not to do it across the board, but it's to find where there are cases and take actions early to prevent them from becoming campus-wide. If it comes campus-wide, they'll have to decide whether they go online, for how long, and how they do that. And they really had those. They had that contingency developed from the beginning, knowing that might be a possibility at some point.
Hi, Governor. This is John Daly, Colorado Public Radio. Following up on the college question, is there a certain threshold that you and Dr. Herlihy and others are looking at as potentially into the red zone, where you would advise colleges they need to shut down, something akin to what happened with the ski resorts in the spring?
So a lot of those protocols for colleges are not shutting down. They're going to online instruction for a period of time. So that is already the case for the students who live in the dorms that are quarantined for 14 days. They then will be tested when those 14 days are over. But during those 14 days, they are attending class online. So ideally, that would just be some students at some periods. But if it becomes widespread enough, then yes, many, if not all, of the students would attend online for a period of time. But I know that we rely closely on our partners across our college system to do the best that they can to identify and act early to make sure that only a limited number of students are required to do the online-only piece. Dr. Herlihy?
Yeah, I mean, I would just add that it's complex decision-making, right? There's lots of factors that go into, evaluating the amount of disease transmission that's occurring in various settings, whether that's on a college campus or elsewhere. We're certainly looking for acceleration of disease transmission. Universities are unique environments in that there is student housing, and so adequacy of housing is certainly going to be an issue, adequacy of case investigation and contact tracing resources, and this is really why we're working closely with our local public health partners and our universities to make sure they have the resources they need to properly respond.
And can you address kind of on-campus versus off-campus living? I know we've been looking into both because many of our colleges have both.
Yes, and so there's been a variable experience really across the state and even across the country. But in general, we do know that there is risk of transmission. We see the greatest risk of transmission for COVID-19 generally in households. And so that can be households that are on campus, dormitory type settings, or that can be households that are off of campus. And whether that's, Greek life housing or private apartments that students are living in, those all represent locations where transmission can be occurring. And we've really seen examples of transmission occurring in all of those settings in the outbreaks that we've seen in the state so far in university settings.
And there's extra risks associated with the dorm living and congregate living, but also extra techniques we're able to use, like the sewage monitoring and more widespread testing. So while the risk is innately greater of congregate living, there are a lot more tools to keep it safer than there are when students disperse to wherever they go and live in large groups off campus.
Hello, this is Meg Wingeter from the Denver Post. I wanted to ask about, so it seems like kind of a philosophical shift from statewide rules to each county doing things based on its own risk factors, but there's nothing really to stop, a person from Boulder or the Denver area from, deciding they want to go to Gunnison County or one of these places with fewer restrictions. So what is the plan to try to prevent areas with more spread from then seeding areas that are in this protect our neighbors phase?
Yeah, a lot of our mountain communities that receive visitors from the Front Range and from across the country really are in the forefront of keeping their residents safe. Many of them have municipal mass orders that go well above and beyond the state order. Remember, the state is only inside. Many mountain cities have downtown mask wearing requirements. Many of them have additional protective elements around testing to keep their residents safe. Because whether a visitor to Gunnison or Vail or Aspen is from Denver or Aurora or from Austin or Miami, anybody could potentially have the virus. And so a lot of those communities have really been leading the way in finding safe ways to host their primary industry and reopen their primary industry and even have a summer tourism season that was close to normal even amidst the pandemic. And largely they've been very successful in doing so. Devolving even more authority through the Protect Our Neighbors phase will be another step in that direction. Many of these communities were in the forefront of receiving variances. Eagle County was one of the very first ones granted in the first phase of reopening as well. Others from the room? Jesse.
I wonder if you're seeing any community transmission linked to K through 12 schools in Colorado related to some of the cases that are there, or if that's really been mostly contained.
Yeah, so we certainly have seen outbreaks in K through 12 settings. Those outbreaks are posted on our website like other outbreaks are. It's been a smaller number, I think, than we've seen in the university settings. And some of that makes sense when you think about some of the risk factors that exist and the behaviors of 18 to 22-year-olds. So I think there are some differences, and there's housing differences as well, of course. But yeah, we have seen certainly outbreaks that have occurred in K through 12 settings. And again, they're posted. You can check out where those have occurred.
Can you talk about kind of how the goal, again, containing to classroom level rather than school level and that sort of thing?
Yeah, absolutely. So one of our primary strategies around preventing disease transmission in schools has been this cohorting approach. And I think going back to what the governor was saying about these super spreader events, we really want to try and limit the number of individuals that are interacting in all settings, including in classroom settings. And so that is one of the reasons that one of our primary strategies is to really ensure that those classroom groups are small, so that when a case occurs, the number of students that are exposed is small, and that we can effectively do case investigation and contact tracing work to limit ongoing transmission.
Thank you all. Stay safe, Colorado.